The World Health Organization now says nearly 15 million people have died of COVID-19 or because of its effect on health services. COVID-19 hospital admissions and deaths are forecasted to rise in the U.S. for the first time in months. ER visits have increased 44% in the past 2 weeks, and infections are up 27% since last week. But nationally, hospitalizations are still significantly lower than most other points in the pandemic. So what does that all mean for Americans who are finally getting back to a sense of normalcy, or very eager to at least? Let's bring in ABC News medical contributor and Stanford Health physician, Dr. Alok Patel, for more on this. Dr. Patel, thanks for being here. FDA officials are now saying that annual COVID booster shots may be necessary. Why is that? And is there any reason to be concerned?
Well, good morning, Diane. I think to address your latter point, I think there is a reason to be concerned, but not necessarily to the same degree as where we were before in previous surges. But the concern comes for those who are not yet eligible for a vaccine, parents, young children, or parents of those young children, or possibly those who are elderly or high risk, where we don't really know what's going to happen with future variants. But I think we have enough seropositivity or natural immunity, enough treatments, and enough vaccines out there, at least for those who can access them, to be a little optimistic about our ability to handle another surge. But again, a lot of unknowns. And Diane, when we talk about the potential for a booster shot, the reason that this is in discussion right now is because there is a debate happening between what type of booster, who would need them, and when I say what type, if it needs to be variant specific, which is exactly what the FDA should be talking about this summer.
So do you think we could see a return of restrictions like mask mandates in some of these areas with high transmission, or now that we have all those measures you just said, including vaccines and new treatments, do you think we can kind of handle a surge, if that's what this comes to, without having to go that far?
I don't think it would be popular, but I think it's entirely feasible to say that we may have a return of mask mandates and or vaccine checks at particular locations. I think it's too early to say that they're going to happen in a widespread area because, again, they're not going to be very popular, but I think it's entirely possible we'll see them. I do not think lockdowns are in our future. And I say that because when we talk about these levels of layered protection, oftentimes people who oppose them will jump and say, don't lock us down again. That is never on the table. No one has ever suggested that in the current era when we are right now in the pandemic. But I think it's feasible that the mask recommendations have come back, that they may be followed by mask mandates should we see the levels continue to increase in the way they are right now.
And doctors are investigating now why some patients are reporting that their COVID-19 symptoms have returned after they finished courses of Pfizer's antiviral drug Paxlovid. Experts are still encouraging people to take the drug if it's prescribed to them. So what do you make of these reports and recommendations?
I think it's extremely important that people continue to still take the medication if it's indicated, because it is still by all means preventing those severe cases. But Diana, it should provide the public some reassurance that the drug manufacturers, public health agencies, the FDA are taking these cases very seriously, even if right now it's a lot of anecdotal reports and about 2% that are reported. And one of the biggest things that we need to tease out is if somebody is high risk, for example, if they're immunocompromised, do they need an extended dose of Paxlovid? Because if your symptoms return back on day 5, we can assume that that person is still infectious, which means that there's not only a risk for themselves because of the viral load, there's a risk for people around them who may not have the proper level of protection. So it's important that we figure this out and we make those necessary changes depending on the individual.
It sure is. All right, Dr. Patel, always great to have your analysis. Thank you.
Dan, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.